Preterm baby is an infant born before the 37 completed weeks of the gestation, further classified based on the gestational age. Late preterm 34 to 36 weeks, moderate preterm 32 to 33 weeks, peripreterm 28 to 31 weeks, and extremely preterm less than 28 weeks. Maternal factors: previous preterm birth, multiple gestation, short cervical length or the cervical insufficiency, uterine anomalies, infections, preeclampsia or the eclampsia, premature rupture of the membranes, and the smoking, drug use, and the malnutrition. Fetal factors like intrauterine growth restriction, congenital anomalies, and fetal distress. Clinical features of the preterm babies: low birth weight, less than 2,500 grams with a lower weight in the earlier preterm infants. Thin translucent skin with a visible veins, decreased subcutaneous fat on the lanogome, weak muscle tone and the poor reflexes, respiratory distress due to the surfactant deficiency, difficulty maintaining the body temperature, increased risk of infection, immature immune system. Complications of the prematurity: respiratory distress syndrome due to the surfactant deficiency, requiring the CPAP or the mechanical ventilation, necrotizing enterocolitis, intestinal injury leading to the feeding intolerance, abdominal distension, intraventricular hemorrhage, bleeding in the brain, common in very preterm infants, patent ductus arteriosus, persistent fetal circulation causing the heart failure, hypothermia due to the lack of fat and the immature thermoregulation, hypoglycemia due to the proper glycogen stores and the immature metabolism, retinopathy of the prematurity, abnormal retinal vessel growth can cause a blindness. Immediate care in the NICU: temperature regulation, incubator or the radiant former, respiratory support, CPAP, surfactant therapy for the RDS, fluid and electrolyte management, IV fluids, CTPN if unable to feed, infection control, strict hygiene, early antibiotics if needed, nutritional support, NGT feeding, expressed breast milk and the fortified formula, long-term care, developmental follow-up for the neurodevelopmental delays, screening for ROP, retinopathy of prematurity and the hearing loss, and vaccination and infection prevention, RSV prophylaxis. Preterm birth, delivery before the 37 weeks of gestation. Major risk factor: previous preterm birth, multiple gestation, infection, maternal illness. Late preterm 34 to 36 weeks versus the extremely preterm less than 28 weeks. Preterm infants have the respiratory distress, hypothermia, feeding difficulties, and the infection risk. Respiratory distress syndrome is due to the surfactant deficiency and necrotizing enterocolitis and the intraventricular hemorrhage and the serious complication. Management include the NICU care, respiratory support, thermoregulation, and the nutritional support. Long-term follow-up for the neurodevelopment, vision, and the hearing assessment is essential.